New figures from the Department of Health today, a big rise in the number of people who have sadly died because of coronavirus or COVID-19. The figure of dead, the figure for the amount of people who died yesterday was 11. Today, that figure is 21. So 10 more people have died in the last 24 hours because of COVID-19. The other figures that we should be watching very closely: 1,140 people have tested positive for the virus. That's up from nearly 800 yesterday. So that's a significant rise. We expect this to be the trend now. Once you get into the hundreds and the figures keep multiplying, we're not going to have little jumps of 10, 15, 20s. We are going to have 50s and hundreds.
That's positive cases, right?
Positive cases. 21 people have sadly died. All of these people, it has to be stressed, are elderly patients with underlying health concerns, and they are across the UK, mostly in London today, some in the Midlands and some in the Northwest. We were talking earlier about the new testing regime that was announced by the government last week, a couple of days ago, in fact, where only patients with respiratory problems who are already in hospital will be tested for COVID-19, and how that would impact on the data that's being collected. I understand, after having spoken to the Department of Health just a few minutes ago, that that regime has not begun yet. It is likely to begin in the coming days. So this is, these figures are comparable to the figures we saw over the last few days and weeks. Professor Chris Whitty, recognising just how difficult this must be for people watching this at home, for a sudden and shocking rise in the number of people.
Because we haven't seen double figures.
We haven't seen double figures. We've seen one case a day, maybe every 2 days, and then we saw double digits. We saw 2 people die, and we thought that was significant. And then suddenly to go from 11 to 21 is quite significant. We were warned all along, Kimberly, that this was going to happen. But when it does happen, it doesn't soften the blow, especially for the poor families who have lost their loved ones.